One man, Donald Trump, lit the flame for the massive assault on the US Congress on January the 6th, 2021. So says the report produced after 18 months of investigation by the House committee charged with determining what happened on that fateful day.
We're going to walk down, anyone you want, but I think right here we're going to walk down to the Capitol. Freedom!
The report asserts that Donald Trump criminally engaged in a multi-party conspiracy to overturn the legal results of the 2020 presidential election and failed to act to stop his supporters from attacking the Capitol. 5 people died as a result of the violence. In a first in American history, the committees recommended the Department of Justice investigate a former president on criminal charges including fraud and incitement to insurrection.
On Friday, North Korea's foreign ministry denied a media report that Pyongyang had supplied munitions to Russia. That was first reported in Japan's Tokyo Shimbun newspaper. The paper had said that North Korea had shipped munitions to Russia via train through their shared border last month, including artillery shells, and that more were expected in the weeks to come. The White House said on Thursday a private Russian military company, the Wagner Group, took delivery of an arms shipment from North Korea to help bolster Russian forces in Ukraine. The UK also said it had come to the same conclusion and condemned the move. But Wagner's head, Yevgeny Prigozhin, dismissed the talk as gossip and speculation. And North Korea's foreign ministry spokesman said the report was groundless, that, quote, the Japanese media's false report that our country offered munitions to Russia is the most absurd red herring. The statement did not make any mention of Wagner. And the Russian mission to the United Nations in New York did not respond to a request for comment. The South's foreign ministry said they had been monitoring North Korea's activity amid concerns over possible arms transactions with Russia. The back and forth comes after a year in which North Korea has tested an unprecedented number of missiles, including an intercontinental ballistic missile designed to reach the U.S. mainland. China is scrambling to avert a collapse of its public health system after President Xi Jinping's abrupt abandonment of the country's strict zero COVID measures to stamp out the virus. At a public hospital in Shanghai, one 30-year-old doctor named Nora, who would not give her full name because of the issue's sensitivity, spoke to Reuters. The situation she describes as of a system straining under the reopening. Nora says patients fight with doctors to access cough medicines and painkillers that are in short supply, that medics are overloaded, that infected staff continue to work because personnel are so scarce.
Especially the doctors working in the emergency department and the infection disease department who have direct contact with COVID patients. They are in short supply because many doctors are on leave. The remaining doctors must take over to maintain normalcy in the medical system. The workload is quite heavy, but the requirement from the hospital is this: if you test positive and experience mild symptoms, you should continue to work.
4 hospital workers told Reuters that insufficient planning for the end of zero COVID has left them to manage a chaotic reopening. And more than a dozen people, from health and policy experts to residents, pointed to the cause being China's failure to vaccinate the elderly and communicate an exit strategy to the public, as well as excessive focus on eliminating the virus. The people said that Beijing spent big on quarantine and testing facilities over the 3 years prior, rather than boosting hospitals and training medical staff. China also declined to roll out Western-made mRNA vaccines, which studies show are more effective than its homegrown shots. A recent drive to vaccinate the elderly has not met with instant success. Government data shows the rate for adults aged 80 and older who had the booster shot is only 42.3%. Alfred Wu is a public policy expert at the National University of Singapore.
China resisted having mRNA, and China did not spend a lot of effort on vaccination of older people. Instead, they spend too much effort on PCR. So a lot of observers already point out that the cost of PCR almost equal to the cost of vaccination. Why not vaccine older people first? But you can see that China did not do that.
China has only reported a few deaths since the reopening, taking the total by Friday to only 5,241 deaths, low by global standards. By Friday, it had reported no deaths for 3 days straight. Meanwhile, people have been flocking to hospitals and clinics in panic after 3 years of government propaganda about the dangers of the virus. And Nora, the doctor, says new infections are rising at her Shanghai hospital, though it does not disclose the data publicly.
The hospital doesn't have a perfect plan to deal with all the problems, and the policy is changing every day. How can we make this process smoother? How can we ensure that people, including both COVID positive and negative patients, get uninterrupted medical services? The policy is still undergoing adjustment.
State media has defended Beijing's approach while recasting its messaging, trying to highlight how mild the Omicron variant is. China's National Health Commission did not respond to requests for comment on how resilient the health system was or the supply of medical staff, whether there were contingency plans to cope with soaring hospital admissions, or whether strict coronavirus measures had impeded improvements to medical capacity. A health official said Friday in state-backed media that China is expecting a peak in COVID infections within a week. Thousands of migrants at the U.S.-Mexico border face the cold and uncertainty going into the holiday season. Hundreds bundled up in coats and blankets were lined up at the crossing near Juarez on Thursday, hoping the festive period will bring answers over whether they can seek asylum in the United States. Many had hoped that U.S. entry would be easier after a deadline to lift COVID-era restrictions on Wednesday, but the Supreme Court ruled to let that policy, so-called Title 42, stay in place. We're waiting. Here they say one thing, then half an hour later they say something else. That's the situation. We don't know anything, said Vanessa Revenga, who has made her way from Venezuela. It's one of the countries, along with Guatemala, El Salvador, Honduras, and Mexico, where U.S. authorities can rapidly expel migrants to under Title 42, without a chance to seek asylum. President Joe Biden's administration has asked the Supreme Court to leave Title 42 in place until after December 27th. For Chris Mary Rodriguez, Christmas will make things even harder for her and her 2 children, who don't know where they will sleep. In other northern Mexico cities, like Matamoros, migrants aren't faring much better. Hundreds plan to spend the holiday there cold and tense, many having been there for 2.5 months, hoping for a change in U.S. policy.
An unofficial strike by rail ticket inspectors in France, where inflation is 6%, means cancellation for a third of SNCF services this weekend. Staff are reportedly unhappy with a 12% pay deal. Passengers are using car shares or coaches instead. Christmas plans disrupted by industrial action. British paramedics are planning a second walkout on December the 28th. In England and Wales, NHS staff have been offered an average 4.5% wage hike. Inflation is 9.3%. Ambulance staff aren't the only ones striking. Further industrial action is planned by Border Force officers, Heathrow baggage handlers and postal workers in the UK's winter of pay discontent.